The Nesa therapy is quite impressive. I have experience in TES, what is called transcranial electrical stimulation, and I had a lot of patients that didn't had the results that I was waiting, especially. And for me, Nesa can be combined with TES, and the results can be improved. My name is Edis Mustafa. I'm a medical doctor working here in Centro Kinetic. I have a quite experience in medical rehabilitation for more than 15 years and a lot of patients, probably more than 60,000 patients treated until now. I think my most important skills are the capacity to communicate with them, to be very close to my patient, to understand their needs, and obviously to have a good CV with different schools and the skills that you obtain in the years, and of course the experience. But I think the most important quality and for a doctor is to have empathy and to be very close to their patient. It's very important to know things about the autonomic nervous system. Why? Because we are usually know to treat only things that we can see, we can feel directly, and what is known from the past. But the scientific research in the last years are giving a lot of recommendations, solutions for the problems that we didn't had until now solutions. And for this reason, researching this autonomous nervous system part, we learn about what means the stress, the pain, what means different myalgic pains, different neurological diseases, guts problem, and a lot of things that you cannot treat it with medical treatments like pills, creams, and so on. That's why it's very important for the population to understand that not everything not every pain that you have is from directly from an organ that you didn't eat so good or didn't sleep so good because of the what you eat the day before. It's very important to know that the quality of our system should be known, should be measured, and if you need help, to be treated. Nowadays we can do all these things, and that's why the quality of life is improved. That's why we live more, because of the research, because of the scientific world that is still searching for new solutions for every person in the world. The symptoms that you can feel as a patient when you have some problems with the autonomic nervous system, you can feel problems with insomnia, problems with the sleeping. You can feel some muscle problems, contractures that if you search with the MRI, you cannot find the herniated disc or the reason. That's why you have to be careful for this autonomic nervous system. I told about fibromyalgia. We can talk about problems after neurological diseases as stroke, as dementia, Alzheimer, and so on. After heart diseases. Every disease or trauma in life can cause different kind of pains, of restriction of mobility, of functionality of the body. That's why the complexity of our body is very important to be treated. That's why this kind of therapies like Nesa is very necessary. And what I wanted to underline in all of this, the modern medicine should be based on prevention. And that's why as a doctor, I recommend this to get evaluated before you have a problem, or even if a chronic disease, you have to pay more for the treatment. You have to have a lot of restriction. That's why prevention is one of the most important things in medical world in our days. The Nesa therapy is quite impressive. I have experience in TES, what is called transcranial electrical stimulation, and I had a lot of patients that didn't had the results that I was waiting, especially. And for me, I know that Nesa, sorry, it can be combined with TES, and the results can be improved. Where I cannot use the transcranial stimulation, I can use Nesa. That's why with this device, with this therapy, Nesa, we can apply for a lot of pathologies, for a lot of kind of patient, youngsters, elderly patient, children. That's why for us it's very helpful, because we can treat we treat in our clinic children from a few months until elderly person 100 and more years. That for us, for the doctors working here in Central Kinetic, we want to have all the therapies in the world, that because we love our patient, we love our work, and we want to give them the most important things and the quality of the treatment to be at the international society's parameter standards. Success, it's something very important in proficiency. Even you are a pop star, if you are an actress, if you are a doctor. Success means that what are you doing, the things that you do, it's good and helps patient and helps the community that which you are where you are living. For me, success means happy patients that are coming and shaking my hand, and thanks for being close to them, being a good advisor, being a good doctor, and that's the reason for choosing my proficiency. The feedback of the patient, the happiness of them, this is for me success.